Okay, so today we're going to learn some simple activities that you can do if you have sciatica pain. Sciatica is basically pain that stems from the low back and shoots down the posterior aspect of the leg, all the way down, sometimes to the foot. It's typically a nerve-like pain. So these exercises are simple things that you can do to help decrease that pain. And it's caused from a pinching of the nerve at the very base of the spine. So the first thing I'm going to have Katie do is stay in this, we call it a hook lying position because the pelvis and the low back is a very neutral position. And she's gradually just going to pull her stomach muscles in and release, maybe 5 times, just to warm that back up and get a little motion going. Good. After the 5th one, she's just going to relax and have that pelvis in a neutral position, and she's going to grab the back of her right thigh with her fingers laced together and her arms relaxed, her shoulders relaxed, and the arms outstretched. She's going to hold the foot in a flexed position. She's going to maintain that ankle in a flexed position and not move her arms and extend the knee till she feels a pull down the back of the leg. And then she's going to keep that foot in that position, and she's going to just basically, I call it priming the pump. She's gently pulling on that sciatic nerve all the way up the back of the leg, through the sciatic notch to the lumbar spine. I typically recommend you do about 15 pumps. Once you get to number 15, she's going to hold her leg up there again. She's having a hard time straightening it, so I'm going to show you a simpler way to do this exercise in case you can't reach your leg or your leg doesn't extend or this is just too painful for you. But here she's going to stay in this position with the knees extended as she can get it, and she's going to just pump the foot towards her. And she's going to feel that pull again down the back of the leg. And I like to do, again, about 15, sometimes even 30 of these. This is a technique called nerve glides or nerve flossing, where you're moving that sciatic nerve all the way through the tissue to the low back to help get it moving again. All right, good. Then when she's done, she's going to let the knee bend, she's going to put the back flat, and she's going to repeat the same exercises on the other leg. Good. Now, I'm going to have her sit up because she had a hard time holding that leg completely extended. So you're going to sit this direction, and you're going to make sure that your spine is nice and straight. Maybe pull your tummy muscles in. You're going to flex that foot. Let's do the left leg. There you go. Good. Hold the foot back, and then bend the knee and straighten the knee 15 times. So this is a little bit easier position and a less of a gradient. Does that feel a little easier? Mm-hmm. Good. Do you still feel the pull up the back of your leg?
Not as much.
Okay. Good. Now some people might even have a very tight leg, and when they do this, they might lean back in order to do it. We don't want that. If you have to do that, then you're going to have to kind of brace with your fingers and your arms and hold yourself there. Good. But she does a good job, and she's got enough length in that muscle to keep this torso and hip at a 90 degree. Once she's done 15, she's going to hold the leg straight out in front of her, and she's just simply going to pump that foot 15 to 30 times. And when she's done there, she's going to repeat on the opposite leg. Good. These exercises are best done 2 to 3 times a day when you have acute sciatica. Something that I failed to mention in the earlier video is that you definitely want to do these exercises in a kind of a pain-free motion. So again, if Katie's in the supine position on her back with her arms extended and her foot is flexed, and she starts getting shooting pain all the way down the leg, at this point she's going to stop there. She's not going to push it any further because we already have inflammation going on. So she's just going to prime this pump in a very pain-free range of motion. And then if this is the pain-free range of motion, she can also do her ankle pumps here. A lot of times in the clinic or at home, you can do these exercises by placing a cold pack underneath your back at the same time as doing the exercises. Thank you.